The patella, also known as the kneecap or kneepan, is a thick, circular triangular bone which articulates with the femur and covers and protects the anterior articular surface of the knee joint. The patella appears in the majority of vertebrates with a femur, for example mice, cats, and birds, but not whales or most reptiles and amphibians such as snakes or frogs. In humans, the patella is the largest sesamoid bone in the body. Babies are born with a patella of soft cartilage which begins to ossify into bone at about 3 years of age. Structure. The patella is roughly triangular in shape with its base facing proximally and its tip facing distally. Its anterior and posterior surfaces are joined laterally by a thinner margin and medially by a thicker margin. Anterior surface. The anterior surface can be divided into 3 parts, the upper third is coarse, flattened, and rough. It serves for the attachment of the tendon of the quadriceps and often has exostoses. The middle third has numerous vascular canaliculi. The lower third includes the distal apex which serves as the origin of the patellar ligament. Posterior surface. The posterior surface is divided into 2 parts. The upper 3/4 articulates with the femur and is subdivided into a medial and a lateral facet by a vertical edge which varies in shape. 4 main types of articular surface can be distinguished. Most commonly the medial articular surface is smaller than the lateral. Sometimes both articular surfaces are virtually equal in size. Occasionally, the medial surface is hypoplastic or, the central edge is only indicated. In the adult the articular surface is about 12 cm and covered by cartilage, which can reach a maximal thickness of 6 mm in the center at about 30 years of age. The lower part of the posterior surface has vascular canaliculi filled and is filled by fatty tissue, the infrapatellar fat pad. Muscles. It is attached to the tendon of the quadriceps femoris muscle, which contracts to extend straighten the knee. The vastus intermedius muscle is attached to the base of patella. The vastus lateralis and vastus medialis are attached to lateral and medial borders of patella respectively. The patella is stabilized by the insertion of the horizontal fibers of vastus medialis and by the prominence of the lateral femoral condyle, which discourages lateral dislocation during flexion. The retinacular fibers of the patella also stabilize it during exercise. Variation. Emarginations are common laterally on the proximal edge. Bipartite patellas are the result of an ossification of a second cartilaginous layer at the location of an emargination. Previously, bipartite patellas were explained as the failure of several ossification centers to fuse, but this idea has been rejected. Partite patellas occur almost exclusively in men. Tripartite and even multipartite patellas occur. Development. In the patella an ossification center develops between the ages 3 and 6 years. In animals, the patella has convergently evolved in placental mammals and birds. Most marsupials have only rudimentary, non-ossified patellae although a few species possess a bony patella. A patella is also present in the living monotrem's, the platypus and the echidna. In more primitive tetrapods, including living amphibians and most reptiles, the muscle tendons from the upper leg are attached directly to the tibia, and a patella is not present. Function. The primary functional role of the patella is knee extension. The patella increases the leverage that the tendon can exert on the femur by increasing the angle at which it acts. Clinical relevance. Dislocation. Patella dislocations occur with significant regularity, particularly in young female athletes. It involves the patella sliding out of its position on the knee, most often laterally, and may be associated with extremely intense pain and swelling. The patella can be tracked back into the groove with an extension of the leg, and therefore sometimes returns into the proper position on its own. Etymology. The etymology of patella presents an interesting case of convergent etymology. In the Western world, patella originated in the late 17th century from the diminutive form of Latin patina, meaning shallow dish. The use of this term in Eastern medicine, however, predates the Western etymology. As early as the 13th century, traditional Ayurveda practitioners in the Indian subcontinent referred to the kneecap as paw to the first Lahore AA, literally farmer's bone because the grueling life of a patidar. The term was subsequently shortened to just pə́tɛlə. During the British Raj period, Western medicine was introduced to India, and the two etymologies converged into the modern medical use, with two L's. See also, this article uses anatomical terminology. For an overview, see anatomical terminology. Knee, patella reflex, knee pain, knee osteoarthritis, lateral retinaculum, lateral release, additional images, references. External links, Patella overview. The Knee Guru. Retrieved March 2010.